of the most difficult profession. So how you have chosen this profession, ma'am?
I wanted to be in that profession where I could serve the women from remote areas also. I had to look around 60-70 patients per day. To me as their family, I treat them as their family. They can talk to me anytime. So nowadays I become more empathetic towards their problem.
What is the prevalence of nowadays cervical cancer, ma'am?
Cervical cancer, it's there. There's a good number of people are getting cervical cancer. We get them in precancerous stage. That means if they are not treated for more upcoming 10 years, then they will get cancer. So they are immediately referred to our center like us. So we go with colposcopy, thermocoagulation and other modalities of treatment. So it is decreasing massively nowadays.
A message to your friends, to your family members.
Women should love themselves. So we should give more time to ourselves, like our diet, our exercise. We should be mentally stable. Our mental health should be good.
So good morning. Once again, we are back on another show of Hello Doc. And with me today is Dr. Neeta Timilsina from Bhaktpur. So ma'am, to start with, I would like to ask you, because this is one of the most difficult profession. So how you have chosen this profession, ma'am? Or somebody from your family have asked you to look into this profession. So how actually you have been into this profession?
I was passionate about this profession from my childhood, but after MBBS, there was one of my teacher who guided me, telling about the pros and cons of gynecology, as well as my mother was also very interested. She wanted me to be in gynecology because she knew the problem of women's from her childhood. So, and another factor is I wanted to be in that profession where I could serve the women from remote areas also. So I am nowadays going towards to the remote areas to serve them in the form of camps. And so I also had one of the soft corner for women's in Nepal. So I chose it.
And ma'am, it is a very challenging profession. Compared to a normal woman going to a bank for 10 to 5 job, this job is very challenging. There is no time. You can have to go even maybe in the 12 o'clock in the night for some delivery, emergencies. So how you manage your work-life balance, ma'am?
Your partner, your family plays a very crucial role in managing these things. We being women, we cannot deny the familial part. We cannot remain unmarried and without child. So we go with it. But for myself, in managing this professional and personal life, my family, my mother-in-law, my husband, they take care of the familial things moreover. And so I am more into my profession, so I can manage it easily because of them.
Mhm. But many times you must be missing. I wanted to see how my child has taken the first step.
Yeah.
Those memories, many times you must be missing, and you thinking that whether I should continue into this profession or I should go back.
That was the same thinking of mine, and I used to share with my husband. He used to say that one day your son will be proud of you because of these things. So instead of looking into the things you missed, think that you are one of the frontliner. You are dealing with those females taking care of babies and mothers. So missing those things are minor in compared to your profession and your achievements in saving 2 lives at a time. So I take that way that we have to we cannot get both things in life at the same time. So I have to miss those things because I am in a noble profession where I save 2 lives at a time.
And coming from family to your patients, when a doctor-patient relationship is very important. And many times when most of the patient think like that, a doctor is like just like a god. So what is your feelings towards your patients when they are actually coming to you, and how you are actually taking care of your patients?
I was in a medical college 4 years, for 4 years back. At that time, I had no time at all to talk to patients in detail. I didn't have time and to talk to them to their problems and those things. So I had to look around 60 70 patients per day. I had to take rounds of 90 patients per day. And at that time I thought it is not good to do practice like this, because I am not in touch with the patients, and the patients also don't know about their disease itself, about the doctor treating them. So now I have left that medical college job where I had to look for massive number of patients, but with not that much good care. But now I'm in private practice, and when one patient comes to me, eventually that patient becomes my family. Nowadays it's happening to me, and they treat me as their family. I treat them as their family. They can talk to me anytime. So I nowadays I become more empathetic towards their problem and treat accordingly. Now I have changed my way of treating the patient.
Yeah, as you
I
said,
see limited patients, but
Yes.
give good care.
yeah, as you said, ma'am, empathy is very important.
Yeah, very important, very.
And when you make your patient just like your family, you feel that yes, he is or she is a
Yeah.
part of my family. Then you
One patient was there, she was counseled about cervical cancer, but that was pre-cancer. And when I counseled her for around 10 minutes, she said, I am getting the feeling like I had come to my Mica and I'm talking to my sisters and all. I am so relieved. At the end, she was so relieved and she left. Yeah.
normally, which type of patients you see more in your practice?
Though I live in Bhaktapur, I am focused in Banepa, which covers more rural areas. Okay, and they are not from those well-to-do family, and they are not the decider of their own health and the family problems. So. My focus is on those patients who come from remote areas and they don't have time. Do you know the patient come there for shopping, and they meet doctor in between, and they do the treatment and they finish their shopping and get back by the time the bus should reach to their village. So I'm more focused over those patients, though they cannot afford private prices. I am very much lenient with them, and I do accordingly. I do those discounts and those treatments which I can do in low cost. So I'm more focused about that.
And do you see a prevalence of malnutrition in pregnant subjects?
Uh, it used to be a few years back, but nowadays almost all people are educated and they know that pregnancy is a state where a lady should get a nutritious diet. So not that much, not that much.
And what is the prevalence of nowadays the cervical cancer, ma'am?
Cervical cancer, it's there. There's a good number of people are getting cervical cancer, but as the government has launched the cervical cancer screening programs like VIA, and also more programs in hospitals and outreaches, so they are screened quite often nowadays. And we get them in precancerous stage. That means if they are not treated for more upcoming 10 years, then they will get cancer. So they are immediately referred to higher center like us. So we go with colposcopy, thermocoagulation, and other modalities of treatment. So it is decreasing massively nowadays. But I recently have diagnosed 2 cancers. But that means it's prevalent. In my clinic, I get a few number of patients, and among them also, if I'm getting cancer, that means if I do the projection, it's high.
So, what is the advice you would like to give to such patients or such society so that they should not be getting this cervical cancer?
Yeah, this is the thing which I do in my clinic every day with every patient. Though they come with some problem like cyst and tumor or pain, I counsel them. Do you have done the pap smear test, the cervical cancer screening, the VIA test? And many of them say, yeah, it was done in the camp, it was done in the hospital. And many of them say, what is that? They don't know. So I now start my counseling of 5 minutes, starting from WHO, from Nepal government's program, and I say them every 3 years you should screen your cervical cervix for any precancerous lesion, so that I can save you from the cancer which will happen around 6-7 years later. So I give them the option, and they get confused, and I ask them, yeah, you are here with another problem, but I'm counseling for another thing. It is not that you should do this at the particular time, same day, but you can come later. But you should get the knowledge that you should be screened anytime in your life, every 3 yearly, and this is my duty to warn you. So I'm giving you the information about this thing. So even though many of them agree immediately and they do pap smear test, and many of them come later on, they are coming because of the counseling. That's in this way I'm doing the impact. And I also go in many government camps or other private hospitals camp where I go and do VIA test and pap test. I'm doing that again and again.
So as you said, ma'am, counseling is very
Yeah,
important.
very
for
important.
substitution. And any particular message you would like to give to your pregnant subjects, how they should, what they should do during pregnancy, what they should not do, so for a healthy baby outcome.
Okay. Actually, pregnant ladies should be ready from 3 months prior to pregnancy. She should do preconceptional counseling. She should start with folic acid and see if she has any other diseases like hypertension, diabetes. It should be controlled, and then only she should enter into pregnancy. And after coming into pregnancy, it's a long period of 9 months, so we cannot particularly tell them do this in pregnancy or not. We counsel them according to the trimester. That means first 13 months, likewise. And in first 13 months, they should not do the heavy weightlifting things and sexual contacts and other like more stressed out like these things. And we tell them to keep on coming and doing the antenatal care. And they should take folic acid continuously. And if they have any diseases, under the supervision of doctors, they should take those medications. And we counsel them for the anti-NV scan, the dual marker test as per the need, the anomaly scan, the glucose tolerance test, and growth scan, like that. And we keep on monitoring monitoring their blood pressure and sugar throughout the pregnancy. And we ask them to be mentally stable, and physically also they should have 8 to 10 hours sleep at night and 1 hour nap in between the day. And they should not take junk foods and the drinks, sugary drinks, much more amount. And they should be focused and healthy diet. Likewise, we counsel them.
Thank you, madam, that you have given a lot of insights for pregnant subjects, to patients who can be prospects of cervical cancer. I think when people will hear to you, they will be following your whatever you have said. But in the last, I would request you to give some message to your friends, to your family members.
I want to give one important message that women should love themselves. Because if I take care of myself, if I become healthy, eventually my child, my family around me, family members will get healthier. And if I live longer, I can take care of them for more time. So we should give more time to ourselves, like our diet, our exercise. We should be mentally stable. Our mental health should be good. So please, first of all, take care of yourself, and then eventually you will be taking care of your child and family and your profession as well. Thank you.
Thank you, ma'am. Thanks for coming today for this podcast.
Welcome.